Good afternoon, everyone. Gareth Presh, founder of the World Health Innovation Summit, and welcome to our third session from Europe discussing COVID-19. And I'm delighted to welcome Dr. Ron Daniels, Josh Ludko, and Shima Sezgari from Switzerland, who's joined us in Geneva today. I'm going to start with just maybe speaking to Ron initially, and just maybe give us some context around a short introduction, and then UK, and how has COVID impacted the UK?
Of course, Gareth, and thank you. So I'm Ron, and my background is an intensive care doctor. So I work in the NHS. Several years ago, I recognized the harm that infectious disease was causing at that time and started a charity, the UK Sepsis Trust. Since that time, I've come to sit on the board of the Global Sepsis Alliance, which represents over 40 countries around the world. So we've been active in the field of infectious disease and talking about pandemic preparedness for some time. But when this began to hit, and I think I work in Birmingham in the UK, and we had 2 weeks luckier than London. We started to understand that this virus was coming, that this was no longer a MERS or a SARS. This was very real, and it was going to hit us hard. It hit London very early on, and they weren't yet fully evolved with their surge planning. We had another 2 weeks in Birmingham. So the hospitals filled, but we had built that surge capacity, and we just about coped. And indeed, nationally, we saw the building of large 1,000-bedded Nightingale hospitals. They weren't needed in the end because the NHS hospitals just about coped. But it was hard. And the real challenge for the UK now that numbers in hospitals are reducing, testing's going up. So we're starting to see numbers going up, but they don't seem to be getting quite as ill this time. The real challenge is how we rebuild the NHS, get it back to business as usual, treat these other chronic and acute conditions, as well as prepare for a second wave, if indeed there is one. And at the moment, I'm a bit skeptical about whether we'll see a second wave.
No, that's great. And I think we'll touch on the NCDs and bringing back, there's been a huge backlog in elective surgeries as well. And how do we get those back in motion? Because that, of course, will cause mortality rates to spike as well in the next 12 months. So it's going to have a huge impact. Shima, can I come to you in Geneva in Switzerland? Could you give us an insight into what it's been like from the COVID perspective, from the Swiss's perspective, how it's hit and the response?
Thank you very much, Gareth, to having me in your discussion. I think Switzerland has handled COVID very nicely in terms of mental approach. Because, we had this period of confinement and also, all the necessary guidelines to be respected. Nonetheless, we had this kind of freedom of education, or I would say information that had been provided through Switzerland authorities to avoid this kind of isolation and, impact in mental health people. So they handle it very well. Although we have a rise of numbers today for COVID because of opening the borders and because of multiple testing now, because we test a lot more. So the numbers are rising, but I'm confident that sometime soon we will find a solution for COVID.
Yeah, no, that's great to get an insight from Switzerland. Maybe Josh, you've also will be able to give an insight into the response that Germany's had, been very publicly praised in terms of how Germany has handled the lockdown. Could you give us an insight from your perspective how Germany have done?
Sure, absolutely. Yes, Germany has been exceptional in its response. As soon as the pandemic was identified and came out, there was very instant compliance by the populace to follow the guidance that was coming out of the World Health Organization as well as the German government. And there was great coordination at the top that was occurring. There was also various innovative ways that they were using to stem the spread of COVID. So, for instance, here in Heidelberg, they had mobile care units that would actually go to people's homes and check on them rather than force them to come to the hospital or the clinic to try to keep that social distancing intact. Right now, we're sitting at a really great place. The schools have been open now for a few weeks. People are moving, but the compliance is still there. They're still wearing masks. They're still social distancing when appropriate. So it's been good.
Yeah, no, thanks for that, and good timing, Isabella, who's joining us from Geneva from the WHO. We're just doing some brief introductions. Perhaps you could give us a brief introduction. We're just going into the detail of COVID, and Ron's given an insight into how the NHS has responded, and Chima's spoken about the Swiss response. Just from your perspective around maybe information as well and disinformation, from the WHO's perspective. How do you? Could you give us a sort of overview of COVID and the impact?
Thank you very much, Garrett. I hope you can hear me well. Thank you so much. Yes, for what happened in Switzerland, I think it was, what you call not the full confinement. It was different because the people. It was more preventive measure. In fact, it was to engage the population in very soft way, I will say, to take the appropriate, disposal, to prevent, in fact, the scale up of the epidemic. And I think that was quite good. The approach was very good because it was not like a shock. It was step by step. And it was as well enough time for the people to understand, what is going on, and as well to be able to have this appropriation by themselves, about what they need to do, in fact, to protect themselves and as well the other. But for that, I think it was quite a good answer. After what was a big issue, and specifically from WHO perspective, it is the fact it was difficult to, and we still. We have not the full information. We have not the information about, for example, the origin of the virus. What have been, the full traceability. We don't know. And okay, it was a lot of issue of information. Missing, in fact, in the process. To inform as well the people. It was difficult in terms of decision making because when you have not all the information, or accurate information, you cannot be so straightforward. It's for this reason I think many countries, have decided to take so different initiatives, different measurement, and sometimes I think it was without, unfortunately, the full engagement or the full understanding of the population. And I think that was the big part of the problem for me, But from Switzerland, from what I have seen in Switzerland, it was better, to in this way for them to engage the population and to inform the population.
Absolutely. I was going to come to Ron. Ron, around the information and misinformation and the dissemination of information. I mean, this morning we had a great example from Singapore. They were talking about deaths. Okay, 27 deaths. Okay, that's the total. And then you look at the situation that we've had in the UK over the last couple of weeks and months, and we've been through this. And you, particularly on the front line, have witnessed this. And this huge spike in deaths. The mortality rate this year is up. Over 60,000 excess deaths this year in the UK alone, which is a huge number. Do you feel there's lessons being learned here in terms of how we disseminate information and listening to the evidence-based information? Because what we have to maintain is trust and leadership. And, so I'd really be interested to understand how you feel we can make sure the lessons are learned. You work at the global sepsis community. And in the medical profession, and I've been very much part of that, of quality-driven, evidence-based decision making. And we always talk about, best practice and lessons learned and learning constantly. But how do we make sure that sticks going forward, into the community setting for the next step of this pandemic to avoid future pandemics?
Well, we would hope, of course, that lessons will have been learned. And, one of the brilliant things that's happened in terms of communication is within the medical profession. There's been sharing of knowledge, acceleration of research, international dissemination of new information. At the beginning of this condition, of this pandemic, we didn't really know how to treat patients. We probably put patients on ventilators a little too early. We didn't know what therapies might be effective. Recently, we've learned about remdesivir. We've learned about dexamethasone, two potentially useful adjuncts to treatment. So that's been great. Certainly in the UK, what we've seen is we've got a balance between a rather cautious and, dare I say, slightly paternalistic government that listens to scientists, listens to, in the UK, the SAGE scientific committee, and heeds their advice, but disseminates only a fraction of that evidence, of that information to the general public. So we have a problem at the moment where we're talking about 3 symptoms, we're talking about loss of taste, we're talking about persistent cough, we're talking about breathlessness. Of course, we all know there are a whole lot of people out there who are developing COVID who have none of those 3 symptoms, and they're left with no information. I think the other challenge we had in the UK was at the beginning of the pandemic, it took a little while for us to close down. It took a little while for us to encourage isolation, encourage shielding. And perhaps that's partly responsible for a number of deaths we've seen. We simply don't know. Will lessons have been learned? Well, I think in the medical profession, certainly. But I think what we need in terms of the broader public communication is a balance between the very free speech that we've been seeing on social media, which carries its own dangers, and the very restricted speech that we've seen from some governments around the world.
Yes, of course. Yeah, and we touched on it earlier about human rights violations as well during the pandemic. That's been come to the fore. We, particularly from African colleagues, they raised it this morning about how authoritarian, shall we say, governments have used COVID to their advantage, shall we? So, there is a fine line between following the science and then getting the balance right. And I just wanted to talk about when we talk about certain waves, and it's interestingly, our colleagues in Asia today were talking about, well, they're on their 3rd wave, should we say, but they were very much talking about the psychological impact that comes now, from the point of view of health professionals, but also, the general public who've been, shall we say, cooked up inside. Shima, from your experience, because you work in this area supporting psychological and mental health and well-being and nutrition as well. Nutrition plays a huge role in this. How do you think people can, manage their mental health and well-being? And then I'll ask Josh the same question.
Of course, I think we are a whole and not partially mental health or cardiovascular disease or, I don't know, COVID or infection or whatever. As soon as we look at a person as a whole system and we think and we put in perspective the wellness and well-being of that person at the center, things will change. Nowadays, what COVID impacts the most is NCD's patients, and you go forward, why NCDs are there? These are modern, diseases for our society. Before we didn't have it, now we have it. We have a lot of burnout, we have a lot of depression. Altogether, gives us an impact if we go only to buy or find a way to treat diseases. We would never change, the path that we have taken and we are still on. As soon as we think about salutogenic way or preventive way of thinking, then the methodology will change, the education will change with the kids, and all those things takes time. What I think that we have learned from this period of time is to take one step back and say, okay, we are in an era of science and, innovation and whatsoever we have. What are the differences between this era and the Spanish influenza? right? What have we achieved so far, and how we can react or respond ethically and sustainably to a question that impacts almost everyone now. So for me, putting, of course, nutrition is one of them, but putting a whole person in the picture and combine different therapy in order to tailor-made for each person the solution that that person needs is capital. But of course, we are in massive treatment. I wouldn't say that we shouldn't follow any guidelines or take in account any approach which has been done. But I think we have to tailor-make.
Yes, and this comes into investment, and myself and Ron have had this discussion around the return on investment of intervention early, you know, so to help, because one of the things I'm very conscious of is, and we all are, is the fact that we've got burnout. We've had a huge rate of untimely deaths of colleagues, over 3,000 medical professionals in the last couple of months. It's going to have a severe toll on the medical workforce. And Josh, you're heavily involved in investment and bringing investment together with ourselves around, well-being, preventative measures. COVID will no doubt, if you look at, for example, in the UK, just recently, Ron, you might be aware, smoking, for example, a lot of people have given up smoking. And that's as a direct result of COVID, because people are beginning to understand the value of their health and well-being. So, Josh, do you see investment? Because investment is very important. Will that flow now the other way? Because in the past, you know, I've seen you've presented decks where less than 4% is put into in prevention.
Yes, you're absolutely right. And you know, I've built my whole career around prevention through lifestyle practices. And my family has been doing this for over 40 years. And yes, we do see investment flowing into health and wellness, working on the front end. We're also seeing healthcare practitioners that are no longer satisfied with the healthcare environments that they're working within. Not only are they contending with people that are burned out, but they themselves are burned out, and also suffering from a lot of other diseases that are preventable. One thing that's been very astounding that I've seen here in Germany is a resurgence of lifestyle practices. And so the health statistics for the Germans, like many other countries, have not been the highest. Over half are overweight. The dietary discipline is very low, and many other factors. However, the COVID virus has really awakened the need to change those lifestyle practices. And so I'm seeing it with people eating different foods, with people exercising, becoming less stressed, and finding various ways to embody this into their lifestyle.
You know, that's fine. I think certainly would like to hear what Isabella, within the WHO, is there a realization that, you know, we need to make some adjustments in terms of, because, you know, we face huge workforce challenges and, you know, retention of staff and also new recruits into the health system. Is there an understanding within the WHO that, you know, we need to look at new ways of working to promote health and well-being? I know we've had some discussions around the creative arts, for example. I mean, these are all things that will obviously help in the future, because psychological impact of COVID. What's the approach going forward? Do you think there's a change?
Thank you, Gareth, for this so important question. And I think it is very important, this aspect, because we need to be sure we will take care about the health, in fact, of health workers, you know, and specifically to manage this type of crisis, you know. And the issue, and we have seen that the issue, it is, for example, when you work, you know, non-stop, you know, without any break, you know what I mean? Specifically when you wear the mask, you know, non-stop, you know, you cannot, you know, have time, you know, to come back to something, you know, makes sense. You know what I mean in terms of the well-being. Donc we need to find, I think, in terms of recommendation, we need to find a way, where is the balance? You know what I mean? Where is the balance between my well-being, my health, and how I manage that, and I am full of my potential, to be able to be efficient. You know what I mean? Because if I am exhausted, if I am not feeling well, and after we have discussed that about, burnout, depression and so on, you are not effective anymore. You know what I mean? And you cannot be healthy by yourself, and you cannot take care about the other. Okay, I think some recommendation need to be looked about, what does it mean to provide some guidance about the right balance, the right, intervention, in fact, to maintain quality of services, and again, people-centered healthcare approach, because that is so important, and not again to consider one solution for all, for all the context, Donc we need again to look, context specific, and adapt, in fact, the solution. And what it is terrible, it is in this situation, I think we have missed the fact we have not considered the complex system. You know what I mean? We have discussed that for so many years, we need to consider the complexity, of the health systems, to have more adaptative, intervention, to consider the specificity again of the case. And in this, sometime in this type of decision making, specifically for some country, it was not considered. Okay, I think it is so important to come back to that. I think I hope I have been clear.
Yeah, yes, absolutely. I'm going to just ask Ron from there's a couple of things here that I wanted to touch on. We've seen huge steps in terms of research and development, technology being embraced, NHS's transformation around technology has been, rapid. And also, embracing that from a staffing perspective. And we touched on staff health and well-being, because what I'm conscious is that we need to have learnings in place from other countries and from ourselves, because this is going to be for the long haul. What's your thoughts on how do we make sure we're ready to sustain this over a long time? Because this isn't going to be, 12 months. I can't see this being 12 months. It's 2, 3, 4 years. We need to be dead honest with people, and they have to be prepared to understand what that's going to take. What do you think? How do you think we're going to be able to manage that?
Yeah, no, it's a fascinating question, Gareth. And of course, the reason few other people, particularly politicians, are talking about this is it's so difficult to fix. This is about resilience. This is not about a single product like a mask or a washing of hands. This is about a change in societal values, a change in behavior. Most people around the world have got used to working from home, working in relative social isolation. What we can't do is to go back to a situation where we're having meetings like this routinely in Geneva without thinking about whether we can do it online. We've got to think about mental health of the entire workforce. It's not just the medical workforce, because we know there's going to be economic hardship, there's going to be a lot of jobs lost, there's going to be a lot of long-standing symptoms in people who've recovered from COVID, and we all need to work together to address that. So very much like the fact that, we have the high-ticket items like a mask or washing our hands. It's not as simple as that. This is about respecting each other. It's about changing behavior. And it's about, as Isabella said, it's the whole picture. It's no good washing our hands if we then go to a supermarket and pick up a couple of apples that 20 other people have had their hands on. That's not going to protect you from infection. Similarly, it's no good wearing a mask and using it poorly. That's not going to protect others from you. This is about a responsible society looking after each other and respecting each other. And we've got to have every aspect of society working towards that.
Yeah, and I think the next question I'm going to ask everyone here is, in your opinion, how will we stop the next pandemic? Because one of the things I think that people need to be aware of, with so many changes in our world, and I would say there's unintended consequences that we are probably unaware of at this moment in time, and I mean that from multiple points of view, because if you look at, we've climate change, which is around the corner. We also have, our food systems are very much disrupted. What we eat impacts on our health and well-being, which then has a knock-on effect to the health service, because you have more, shall we say, cancers. So in your opinion, Shima, like, how are we going to be able to, because it's a balancing act, really, like, how can we make this transformational change and bring people with us? I mean, I know the UN have this ambitious SDGs, 17 SDGs, but that's quite difficult for people to get their head around in terms of 17 goals. Perhaps the health is one way we could bring people together. What do you think, Shima?
That's a very crucial question, Gareth. I believe education is a pillar for any changes. Now, what I mean by education is also education at early age. I mean also bringing the sense to our life. How do we eat? How do we sleep? How do we educate our kids, or how kids get education? These are drastic and fundamental issues to be addressed. But little by little, I think we have to start by our communities. We have to start with small distance education, and bring in people and also showcase that is working. It is important that we are not staying only in, words and phrases. We have to put them in practice and show how this is working. How a holistic approach, for example, to health and education, an inclusive education will address all these, transformation. I think I'm telling you that we need a paradigm shift. And here is no way to go back and have our comfort zones and say, okay, we think about it later. There is no later. We are in it.
Yeah, it's definitely moving forward in the age of COVID. It's not a case of looking backwards. And that's hopefully where we can accelerate the decision process, because one of the things and it's really stuck with me over the last couple of months is the fact that, we've known for months on end about the impact of COVID in, for example, we've seen it in China. We didn't really take any notice. And then when it was in Italy as well, Ron, like when we're looking at the situation in Italy, we're sitting there and we're like, well, yeah, that won't happen. We're having concerts outside, and this is just, we need to really learn. Like, we need to really, and maybe Josh, how do you think this will, how can we prevent the next pandemic? And I know you're heavily involved in digital transformation. That's going to play a very important role.
Yes, it's very true. So yes, I agree with what everyone is saying about, our awareness of the importance of living in a healthy manner, I think, is at the forefront. We are flooded with misinformation. We're flooded with bad leadership or disjointed leadership at times. And I think fixing some of those elements are going to be very key. I think organizations like the World Health Organization and others are a very credible source of valuable information. And the focus on that holistic approach that Shima was saying, the technology that we're working on and the business model and our whole approach to prevention for over 40 years has been on being holistic. It is on looking at all of these factors that can enable somebody to be healthy and well. But it's also to recognize that given where somebody is on their life cycle or on their health journey, there might be something that's a pressing issue, and there might be other areas that are not as pressing. So to be able to address each one of those and have them all interlinked, I think is very important.
Yeah, thanks, Josh. I think it's really important. Misinformation is just rife at the moment. I have a big, perhaps Isabella, how do we stop the next pandemic? There's lessons to be learned here. And I know you guys work very closely with WhatsApp and Facebook and other huge technology companies, which we're engaged with as well, with some of them as well. But hopefully there's lessons being learned here around the dissemination of information, and that we can do a better job next time it comes around. But how do you see the next pandemic? How do we stop it? What's the lessons,
I think we need to maintain, what have been invested about, the consideration of multidisciplinary approach, And for example, we need to have different voice, different expertise on board. And what it is dangerous, and can lead to some decision are not adequate, or can hurt, in fact, the population. For example, it is the fact you have not considered what we try, for example, in evidence-informed policymaking, we try to encourage people to consider all the range of evidence, from the different perspective as well. For example, we can address specifically health issue when we consider systematically social determinants of health. Donc, for example, what will be, if we consider an issue, what will be the root cause of the problem? Donc, I have mentioned, when you don't know the origin of this problem, that it is already an issue. You know what I mean? Because you don't know how to address very in appropriate way, the issue, and specifically for the curative part, it's quite difficult. And we have seen that with COVID, because it was difficult, it was like a fight of school of thought, you know what I mean, between different type of treatment, and after, of course, you have the economic issue behind, and we need to be able to again consider, if we want to prevent any situation like that, I think to consider systematically all the range of the sector together. And I think it was not the case, And for example, we need to anticipate as well the consequence, of the issue. And for example, what will be, the damage for the economy, for the social, we mentioned inequalities. We have mentioned, the issue of education, Donc, to anticipate, what will be, in fact, the consequence. And specifically when you change, because it is about the culture change in very short time, When you have this type of issue, you need to reconsider very quickly yourself, and your environment, and, how you can keep as well your positive, mindset in this condition, Donc all these aspects for me need to be better taken in consideration, in this approach, and that can avoid, the psychological issue, the damage, in terms of, for example, the burnout, the depression, and so on, Donc again, I think we need to consider all the full range of the disciplines and not just, health in this case.
Yeah, we do need to break silos, and we do need to change practices. Education is key, and evidence-based leadership is key. Ron, you're very much at the forefront of this. I would be really interested in the next couple of months. Do you see, Health Education England, for example, NHS England, Lancet, WHO, they're experts in the medical field, community engagement, building relationships. It is slightly alien, community facilitation. It's a different kettle of fish. I think this has shown that this is a new area where the medical field and health in general needs to be bridged. You do it very successfully on Twitter and through social media platforms. I think it's so important that we champion people like yourself who are doing this sort of excellent work. It's all evidence-based. It's it's logical. It's common sense, as people call it. Where do you see this as going in the next 12 months through the COVID period? Because we need to build trust. It has to be open and transparent. Do you see that as an opportunity for the likes of the NHS?
Well, I really do. And we can but hope that organisations like NHS England Improvement will take that challenge and, take it by the horns and run forward with it. There are organisations like that around the world that are existing in their comfort zones. They have been working in the same way for a number of years. And this is going to demand huge change, huge collaborative efforts. It's going to demand a lot of trust, because certainly speaking from an NHS perspective, there's often a little bit of a lack of trust about the way the public are going to behave. And as we've heard from Germany and we heard in New Zealand and most facets of the population in the UK, the public can be trusted to behave in a certain way if indeed they understand the rationale for that behavior. And it's around building trust. It's around engaging with multiple stakeholders. I mean, to my mind, and we've talked about education, I believe the young children are absolutely the key to this. We've seen the success that their influence has had in, for example, reducing plastic pollution in the Plastic in the Oceans campaigns. And they are the sort of vanguards of societal responsibility. And if we can get them to understand that infections management is about infection prevention and vaccination and hygiene and sanitation. It's about antimicrobial stewardship and responsible approach to antimicrobials. It's about behavior and it's about health and well-being and nutrition. It's about rapid treatment of time-critical infection like sepsis, and it's about pandemic preparedness. And it's actually all of those four facets together, and they shouldn't exist in isolation. And this is a real whole society issue. I think this is about children, it's about public pressure, and it's about governments understanding that this pressure isn't going to go away and making those organizations, if they are resistant to change, work together and change.
Yeah, absolutely. I mean, so just to give you an example of that, my 7-year-old daughter, she's looking at the TV and she sees people who are not social distancing and they're not, wearing a mask. And her thoughts are, she turns around and says to me, Daddy, I just want to hug my nana and granddad, and I won't be able to hug them until they stop this, And this is my 7-year-old daughter telling me this. Like, she realizes that what they're doing is having an effect on her life. But more importantly, we're worried about her, the grandparents who are shielding at the moment, who are the most vulnerable people. And so we have to have that understanding to take that self-responsibility. So, I mean, we're going to just go around the house and do some final thoughts. Shima, next 12 months and, in the next few years, your thoughts around COVID, its impact, and where do you see actions? Even if you have some tips for people, which will be fantastic, what can people do now to kind of, prepare themselves for the long haul?
Mm-hmm. I think we have to be very realistic. What I mean by realistic, it means only playing around things that we know for fact. One of them is, for example, boosting our immunity. This is a pillar in order to face any diseases in prevention. So what I would say is changing the type of lifestyles that we are managing, not being in a mood of I'm obliged to do that, but willing to change things, because this change brings sustainable solution in health, is one of those things that I would recommend. And of course, since I'm working in alternative field of medicine, I'm playing a lot around homeopathy, herbal therapy, essential oils, which has pharmacological impact in COVID. So bringing things together, I'm confident that if this awareness, which is among people now, and everyone is having this right to, pronounce, even if it is not right. I mean, this is the ethical choice for people to have the right to express themselves. So if we have this, and if we have a platform of knowledge and expertise that we can trust, even if it is not governmental, that's okay too. So we can bring in pictures of good sense and good understanding about science and life, combine both things together. And with that picture, I would say in 12 months period, we can do a lot of good things. Garrett, that we are going to have a 3-day Congress in mental health. Even though we have planned that like a year ago, we didn't know that COVID will hit us. But this is the multidisciplinary engagement of all those speakers who come in for having a good faith in order to bring solutions for people, and bringing this bridge between people and health practitioner and building trust. I think that's the plan for 12 months.
Yeah, and I'll come to Josh, because And also, we'll talk to Isabella and finally from Ron, the value creation, because one of the things I think health systems are stuck in is this idea of cost, where they don't look at, well, what is the value they're actually creating? Because no one in the NHS ever looks at like, well, I've just saved that guy's life, which means he's gone on to become the next Bill Gates. Okay, so he's created millions of jobs or whatever. No one ever looks at that, but that's something we need to start having that conversation very much. So, Josh, from the next couple of months, you're going to be involved in kind of Sustainable Development Goal 3 and this execution of wellness and well-being. Can you see lessons from COVID and how do you think we can change? Because very much you have to build a bridge as well between, should we say, we have to build many bridges, break the silos.
Yes, I completely agree. Integration, I think, is at the heart of a lot of this. It's what Shima was saying, and it's what we built all of our experiences and operations around. But when you can take health providers from a huge variety of disciplines and have them collaborate and integrate with one another, they can generate fantastic outcomes for the clients. But what I also think we have a great opportunity here with COVID, and that is to change the mindset of the individual who has been what I consider outsourcing their health and well-being to others. So it is, to me, astounding how little people know about their own health status, their own health system, their own mental state, their own physical state, their own even financial health and economic health and environmental burdens that they are weighing on themselves. And for them to, instead of outsourcing that to systems that are siloed, burdened, burned out, spare time. For instance, with physicians, you only get maybe 5 or 7 minutes with a physician if you're lucky. But instead to turn that around and to insource it and to take it as a point of interest in your life. It is, again, astounding to me that we know more collectively about our spreadsheets at work, about sports teams, about celebrity gossip than we do about our own selves. So I think this is a great time to do that. And what we've seen as a gateway to doing that is through education. So just like we've been speaking about today, the health literacy of people around the world is shockingly low because there's so much misinformation. And even when we have best practices that are given or guidelines, they are not personalized. They don't match the individual's lifestyle. They don't match the individual's limitations or the individual's passions or interests. So they're really hard to implement and to embody. But we can turn the mindset of our health professionals around to be personalizing this guidance and use technology as well as physical spaces to create these centers of health and wellness. I think will be much more likely.
It's fascinating because I've spent my whole career basically trying to give physicians and consultants time to treat, because that's what they love doing. That's, Ron, that's why people go into the medical profession, I full of admiration because it's so honorable thing to do. But then you realize as well, and I know a lot of colleagues and consultant colleagues have this as well, where they only have a certain amount of time with certain patients because of demand, and even if you look at the GP practice, like for example, you get 10 minutes, and you see 6 patients in an hour, which is, wow, and then, so people need to take that self-responsibility to give appropriate information. Even if you look at technology, a lot of people have a Fitbit, for example, but I speak to some colleagues in the NHS, Dr. Amir Hannan, for example, and he tells me, Garrett, whenever anyone presents in front of me, they never give me the details of their Fitbit, and the question's never asked, despite the fact that Fitbits are sold by everyone. Everyone wears one, and it's supposed to help their health and well-being, but no one has an idea what it actually means. It's just, I did 5,000 steps. What does that mean, from my health? It's just a kind of number. But Isabel, just finally, from your perspective and the WHO's perspective, the next couple of months, building resilience, how do you think things will pan out over the next couple of months?
I think it is very important, to reestablish the trust, and to rebuild, in fact, the sense of community and solidarity among the different people, And for example, what it is beautiful, it is the fact we can still interconnect over the world together and share as well what we do now. Share, our different experience, different perspective, different observation. For example, that is very important to know, from someone is in Australia, what it is the situation in UK, to have this type of knowledge sharing, and in continuum as way, And as well, what is important, it is to stimulate critical thinking and not to think we have the solution, but to question this solution. It is relevant, for this type of circumstance, this type of context. So critical thinking, I think, is very key, to maintain, in fact, this sense of the sense of community, but as well to have the ability to give the voice again to the different people, and to consider the voice with the same importance. You know what I mean? And yes, that it is for me the key elements, to rebuild, the relationship, in fact. Between the people, and to define what it is, and we discuss that together, what it is common, what it is universal to us, what it is common, what it is our common narrative, because we face in fact the same challenge, Donc how we can together, in fact, have this collectiveness, to address in very efficient way, an appropriate answer. Donc that, for me, it's so important. We will continue to maintain this type of dialogue you have created, with your initiative, and that it is so important for me. It is key, and when the people can have a voice, and express, of course, based on the evidence, but not just the evidence, but as well the reality, what we call reality check, Donc we need, again, what we have always preconized in evidence-informed policy makings in WHO. It was to have mixed methodology, not to consider just quantitative, but as well qualitative, information. And I think that have been the missing link, because we have seen a lot of statistics, we didn't know very well, that come from where, and we need to come back to what have been so effective, as well before, and not to think we remove everything, No, we have accumulated a lot of amazing knowledge, and collaboration and dialogue between the different, entities, partners. So we need to maintain that. I think it's very critical.
Yeah, I agree. And Ron, just final words from yourself. I think this is a very important point that Isabella's making, I think, around asking questions. I think we probably don't ask enough questions, and partly some of the reasons why the misinformation is spreading is because people are not, the health literacy is not there to ask the right questions, or to even understand where the sources of information is coming from. The final word to yourself, and because it was from your conversation, Mike, we had a call 2 weeks ago, and this whole day has kind of flourished from this, just from our shall we say, sparking minds.
Which is amazing, and thanks for your huge effort in bringing this together, Gareth. But I really, I agree with everything my colleagues have said, and I've only got a couple of material things to add, because we've been talking really about rehabilitating the whole of society, and that's really important, and we have to do it. The two material things I have to add are, firstly, those who've had COVID will have significant after effects, and they will be cognitive, they'll be psychological, but they'll also be physical. In terms of the investment and return ratio, we cannot afford not to rehabilitate these people. There's good evidence that they're likely to suffer further infection over the next 12 months. They need information. They need better healthy choices. They need rehabilitating into society, but also rehabilitating into the new them. And we've just undertaken some work with the York Health Economics Consortium over here. And we've looked at all of the evidence out there. And what we've said is, if we invest just £1 million in rehabilitation, we'll see returns to society of a minimum of £200 million and as much as £1 billion in terms of returned productivity and returned function. So that's number one. The second material thing is we need to get much, much, much better at using emotion and storytelling in changing the public's behavior. I can tell you now, Gareth, if your 7-year-old daughter was on CNN telling that story about wanting to hug her grandparents, being aggrieved at people not wearing masks, that's going to be more effective than any police force in the country enforcing those measures.
Yeah. No, I totally agree. And I think it's as Shima pointed out, and Josh and Isabel, like, this is the future as well. I believe, we have a great responsibility, because the bottom line is here, and people need to get the message, we do have solutions. We do have knowledge. We cannot use the excuse that there's no money, because how can you say there's no money when we have offshore bank accounts, right? I mean, so let's ask the questions here, like, you know what I'm saying? So if the money is available, we're able to create the value proposition. We understand, I think the very important piece of work that has to be done, I know we're all discussing this at the moment, is bridging into the financial sector. And how do we have the conversation with the financiers to say, look, guys, we have solutions here. Can you give us the investment, if it be government or whatever? Like, because there's private sector as well. Like, we have a mindset where it has to all go through the public sector, and we need to change that approach. We need to ask the questions. How do we make these things happen? Because we can't afford to wait. We have to make these decisions now. It's like NCDs, for example. We know over 50 million people a year die. What concerns me is, as well, is, with COVID at the moment, and you talked about emotional well-being, or emotional telling the story, Ron. Well, we'll just go across from my house here, 60 miles, I'm sure even closer to you guys. You'll see a ward full of sick children with cancer, for example. Okay, remember, these conditions have not gone away, and now is an opportunity to break the silo working, to bring solutions, to bring the best minds together. We have technology. We heard from colleagues earlier today in Australia, who are working in pediatrics or Chinese medicine, and they have solutions. Why can we not transfer that across? We have simple digital technology that we can use to put the solutions on the table, save a lot of lives, and the value proposition you just put there. So if we use that value proposition that you talked about, and that's COVID, okay, that's COVID, which we know affects 1% of the population. Invert that to 99% of the population, and then we talk about prevention at scale. What's the return on investment there? You're talking about trillions of dollars, not just billions. You're talking about a lot of impact. So we need to have those questions. We need to ask these questions. We need to make those bridges happen. So look, this is the third session. We're going to get ready for the fourth session, which is North America and South America. I'm really grateful to our guests today, Shima, Josh, Isabel, and Ron. I hope you've enjoyed the session. We'll have this published online up through YouTube and Facebook. And my final thanks I'm grateful for everyone's input today, and we'll see you soon on the next session. So thanks, everyone.
Thank you, Gareth.
Thank you, Gareth. This is wonderful.